Good afternoon, everyone. It looks like we still have some people logging in, so I'm going to give people a couple of minutes to get on the broadcast, but we're happy to have you with us for Advocacy in Action this month. We're going to be talking about Policy Forum. Want to thank you all for joining us. Obviously, if you're here, you're probably considering coming to the Policy Forum. So we also want to encourage you all to get your questions answered during today's session. So don't wait for us to give a break. Just go ahead and raise your hand if you'd like to ask your question verbally, or put your question in the question field in the GoToWebinar control panel so that we can get those answered throughout the webinar. And we're going to talk a little bit about the details, but more importantly, we're going to talk about the experience that we are planning for you all at this year's Policy Forum. It looks like a couple others are popping in. Joy, do you see anybody else logging in? Would you like us just to get started?
Yeah, I think let's go ahead and get started. Hopefully
okay, thank you.
Will join us.
Okay, great. Well, so on the screen, you should be seeing our website and the Policy Forum page that we've set up for the website. This is going to be where all of the information will constantly be updated. So if you have any questions, obviously you can always reach out to me or Sam or Joy, but also want to encourage you to continue to come back here for updates and additional information. We're probably going to be adding some resources to this page as we get closer to the event. Some of the background materials, some information about ways that you can look into your information about your member of Congress. A lot of that we will be preparing for you to give to you on site as well, but just want to encourage you to continue to come back to this page. I'll show you how to get there. So if you go to aopanet.org, you'll see, if you just go to our main website, and then you navigate over to Advocacy and down to 2022 Policy Forum, it'll bring you to this page. Again, we're going to be putting different information up here regularly, updates specifically as we learn more about the pandemic and the necessary precautions that we might need to take should those arise again. Any questions so far? Nope, doesn't look like there are any. I will just keep right on rolling then. So the Policy Forum is going to be held May 17th and 18th here in Washington, D.C. I happen to be here this week, and I'll just let you know, it is alive again here. I've been coming to the Hill regularly, been doing visits, doing all the protocol and making sure I had my vaccination card with me every time I wanted to go into any of the buildings. But those things are changing now. So we are in a time of flux, but we're also in a time of a lot of energy here on the Hill. And members of Congress are getting out and meeting with their constituents and doing events. Lots of hearings are being held on the Hill. So there's an energy here right now. And I think it's a great opportunity to capitalize on that energy. We may be one of the first organizations that are bringing their group back to Washington, D.C. for an in-person Hill Day. We have seen several of those groups that have come in, particularly in the healthcare space already, as we're looking at packages that certain healthcare bills are currently in and are going to be moving. And so advocates are organizing to come to the Hill and bring their message forward. This is going to be your opportunity to tell the story of orthotic and prosthetic care. Make sure your members of Congress know why it's important that they are aware of what you do every day for your patients, the needs of your patients, and also the challenges that you face as business owners, as students, as technicians, as administrators, as patients. And so really excited about our Policy Forum coming up. It's going to be held at the Hilton Crystal City. It's really close to DC, just right across the river. We'll have buses arranged, and transportation will be all set up. So really, though we won't be walking distance from the Capitol at our host site, we do have a location for the day of the Hill visits on the 18th, on very close to Capitol Hill. It's called the Capitol Hill Club, and it's just right across from the house side office buildings. So it'll be a great home base for us on that day of those Hill visits. But on May 17th, we'll be doing a deep dive, an educational opportunity for you to learn about the policy challenges, about our policy positions, about the legislation that we're promoting, as well as some more intricate details about how to connect the dots for our members of Congress, how to explain our situation, the concerns that we have about our profession and access to O&P care for our patients in ways that are going to make sense to them, in ways that they will see why it's important that their co-sponsorship and support are added to our legislation. We'll have one piece of primary legislation that we're promoting, and that will be the Medicare Orthotic and Prosthetic Patient-Centered Care Act. That piece of legislation has a lot of momentum right now, so we'll be adding to that, and we'll give you the deep dive. We'll talk about all the different ways that you can share your message. I'm gonna stop sharing my screen here, or do we have any questions? You'll see here, there's all the information about the agenda. You know, we'll be sharing additional information in this agenda. These will be updated with more specific links as we confirm our speakers for the event. But really excited about this, guys.
Of course, we'll be emailing as well and follow us on social media. So you don't have to, we'll be prompting you to go back and check that webpage regularly.
Thank you, Joy. Any questions yet? I don't think I see any. Okay. So what we want to do today is talk a little bit about some of our strategy. I think a lot of times we put out the promo messages, we share, you know, here's this big event and here's why you need to be here, but we're not telling you how we're working behind the scenes to make sure that it's the most impactful it can be. I'm here again in Washington this week because I'm doing the same work that I do every day for the profession, for you all. But some of what I'm doing this week is also putting the pieces of the puzzle in the right place so that when you're all here in May, that you can come in and you can just deliver the message. You can seal the deal. We've got a lot of your members of Congress that we've already met with. I think over 112 visits that we've done since last May. So just a really great opportunity with members of Congress and their staff, right? So a great opportunity for you to come in with the constituent voice and land it. Really get that co-sponsorship or make sure that we have the support that we need. There'll also be opportunities if your member of Congress is already, or your senator is already on the bill as a co-sponsor. It'll be an opportunity for you to say thank you, for you to establish a more deeply held relationship with that office, so that when we need a champion down the road, we know that we can go to those members of Congress that have already sponsored our legislation, and are already supportive and knowledgeable about the orthotic and prosthetic profession. We have some districts that we're going to be targeting, and so I'm going to ask Sam if he could give us a rundown of some of our high-profile target districts. If you'll share the member of Congress as well as the district, that would be great, Sam. Thank you.
Sure thing. So I have both Senate side and House side kind of targets for advocacy efforts that we're looking at right now, and these were helpfully provided to us by Alston and Bird and our lobbying team. So we have some members of the Senate who are on the Finance Committee and on the Healthcare Subcommittee. They're very important because that's our committee of jurisdiction on the Senate side. There's Senator Young in Indiana, Cardin of Maryland, Lankford in Oklahoma, Scott, South Carolina, and Barrasso in Wyoming. And for non-Senate Finance, we also have a few. We have Tillis of North Carolina and Blackburn of Tennessee, who actually met a few days ago, or earlier in this week. Yeah. And on the House side, we have Energy and Commerce, which is another committee of jurisdiction. And there's a health subcommittee within that also has a few targets that we're looking at. There's Matsui of California 6, Bilirakis of Florida 12, and then there's also a few Energy and Commerce who are not on the health committee that we're looking at, which is Dejet in Colorado, Colorado 1, that is, and Steve Scalise in Louisiana's 1st District, and Rush in Illinois' 1st District. And there's a few more. There's just Ways and Means has another. There's a lot of subcommittees and committees, you know. But there's Ways and Means, which is our secondary committee of jurisdiction in the House. And there's Buchanan from Florida 16 in the Health Subcommittee, as well as Horsford and Nevada's 4th District. And the last one is Representative Hearn in Oklahoma's 1st District. So we have a few people that we're looking to speak with very specifically, but all members of Congress are important for the work that we're doing.
That's absolutely right. So the numbers matter. Just like Sam just said, it's not, if your member of Congress if you're not in one of those districts or your member of Congress wasn't listed, it doesn't mean that their support and their sponsorship is not important. It just means that we're going to be making some extra outreach to you all. If those are your districts, if those are your members of Congress or your senators, we're probably going to be sending you a designated email and telling you how important this event's going to be. We're trying to get the broadest spectrum of support we can get in the committees that are most impactful to this piece of legislation. I'll share with you what that might actually look like in Congress. So if we have broad support from our subcommittee, our health subcommittees in either Ways and Means or Energy and Commerce, and they're like, let's just attach this language to this big package of legislation that's moving, they can do that, but they have to do it under their committee structure. So the subcommittee can decide, or the committee staff, and under the guidance of the committee members, can decide that they're going to do that. That's the kind of functional way that they're going to get this legislation passed. It then becomes the bigger committee's responsibility to make sure that they approve that move. So you don't want anybody on your committee to vote against something, because then it doesn't matter if it's not going to be added into a piece of legislation that's moving broadly in the Senate or in the House if the committee itself can't get it out with a positive, with the affirmation that that's approved by all members of the committee. So these individuals that we've kind of targeted here are different parts of that puzzle along the way. And most likely our legislation will be attached to something bigger. And that's just the nature of DC right now. I would love to say that regular order would allow for a piece of legislation to move through the legislative process like that I'm Just a Bill video that you may have seen from Schoolhouse Rock back in the day. That is the way legislation gets passed sometimes. But right now, in the environment that we're working in, that's probably not going to happen for this bill this year. We're probably looking at larger healthcare packages that have to move, they're required to move, and making sure that we're able to get enough support so that we can stick it in there and it moves without controversy. I'm going to pause and see if there are questions about those districts. If anybody, wants to ask any more questions about the functional or the mechanics of that.
Not seeing any questions yet, but just a reminder that you can drop your questions into the question box and we'll get those answered for you.
Great. The other piece of this puzzle that I think it's important for us to talk through, and I'm going to actually ask Sam to share a little bit because this will be his first policy forum, and he's been thrown in the fire a bit working with me or under me or as part of my team at AOPA. There's been a couple of times where he's been put on the spot. He's had to answer some questions when I was still on a call with another member of Congress, and he showed up to the meeting and had to get us started. And so he knows what it's like to feel that, pressure that you might all be anxious about or anticipating. That's only natural. What we're going to do on the 17th is hopefully prepare you so you don't feel that way. But I'm going to ask Sam to share a little bit about his experience so far in this role that he's filling at AOPA.
Yeah, definitely. So as Ashley said, I was thrown into the fire a little bit, but it was actually very helpful because I think that in a way, just getting thrown into it, it takes the nerves away a little bit more than if you're really kind of building it up over months and months and months. But I think the main thing that I have to remember, and Ashley has told me this, our lobbyists at Alston and Bird have also told me this, but we're the experts in these situations. When we're meeting with Hill staff, we're the ones who know the most about the OMP industry, and they're there to learn from us. So you're really the expert, and I think that helps give a little bit of confidence to make sure that, you know, that you're not thinking, you're doubting yourself while you're speaking.
Great, it's great feedback. And you shared with me about sort of how the dots started to connect for you over time. Like the more you listened to the messaging and the more you heard, you know, the more you sat in on our meetings. I mean, there have been very, very few meetings that I've done since you've come on board without you. You're pretty much in almost every meeting that I take right now, because it's so important for you to learn and to have that experience, so that you can go and we can expand our reach on Capitol Hill. But you've shared that as you went along, as you heard that messaging, you were able to connect some dots. And you talked a little bit about kind of understanding that first provision of our bill, how it's not about functionally changing something because it's going to immediately make an impact, but it's about the way CMS sees us all in one category. What, you know, is it just hearing the talking points repeated? What is it that kind of gets you there? Just curious.
I think a lot of what helps me is kind of thinking about examples almost of how the provisions apply. And I think that a lot of it is when I'm listening in on meetings with you and you're talking about like your father's experiences providing devices to patients, and using those specific examples that you use to kind of keep it in my brain and tell a story. And I mean, that's really the key with a lot of advocacy efforts, is telling a good story and being able to explain yourself well to people who may not be as well versed in the information as you. So I think that's definitely something that's really made a difference for me.
Wow, that's great advice, and that will be great advice for anyone that is coming to the policy forum. Thanks, Sam. I appreciate you being put on the spot like this and sharing your experiences, because I think they'll be valuable to all of our members that'll be attending the policy forum. There's one other thing that we want to ask of you, and this is it's really important to create an environment where we're able to showcase the profession in its completeness. And that means that students' voices are important, residents' voices are important, the clinicians' voices are important, our patients' voices are so important. And when we can build a good advocacy team around you, as the AOPA member coming to the policy forum, it creates an environment where it shows how many lives are reached by what you do. And that matters because for a member of Congress, those are the people that are going to be voting for them. And some of these members of Congress have very contentious races ahead of them. So they want to be able to reach as many people as possible. And this community might be a community that they've never tapped into, that they just don't have awareness of. And so they're not familiar with their issues. And it's a great opportunity to say, look at all the constituents that are impacted by the work we do, whether it's family members, caregivers, just entire families are impacted by the work you all do, right? So I think having a robust group with you is important. It's not necessary. We can do this just if you can only fly solo and you're coming, we're going to give you the support that you need on the day of Hill visits. We'll have expanded lobbying team on the Hill with you. So no one should be going into an appointment by themselves unless they are experienced in doing so. So don't hesitate to come solo. But if you can bring a patient, or if you can encourage your colleagues to come, if you can encourage a caregiver or family member to come, if you can encourage other members of your team, administrators, or your residents, bring them with you. Invest in this opportunity to have your voices heard on the Hill. and we'll build a really special experience for you all on the Hill based on the type of group that you bring with you. We'll also have an opportunity to have everyone from your state sitting at the same table. And so you'll get to meet your colleagues in your state, and you'll make sure that you're all on the same page. We'll have some prep sessions, some breakouts that will help engage you with each other so that you know how you're going to move forward and carry that meeting. A lot of times we don't know what that's going to look like till right at the moment of the event. And the way that the members of Congress work is that their schedules are usually confirmed sometimes day of. So we get meeting requests or events that are rescheduled or canceled or moved on a regular basis. That's just the way Washington works. And so, if you haven't heard from us, prior about some meetings that have been confirmed, that doesn't mean that all of your meetings aren't going to be confirmed the day of. Or the day before probably, and we'll have all that information provided for you. We're going to be scheduling the meetings for you all this year, but we might be asking for your help if we haven't received confirmation a couple of days prior. We may ask you to reach out to that office directly. We'll give you the contact, we'll share and make sure that it's very clear what you're asking and you're following up on our requests that we've already made on your behalf. So everyone that is registered is asked to provide their address and their details about where they live, so we know their district, and we'll be making those requests for your 2 state senators and your member of Congress on your behalf. Okay, I see a question. What do we got?
Good, perfect timing. This question is, what if I live in Tennessee but work in Kentucky? Will I be able to meet with both sets of representatives?
This is a really interesting question. So I'm gonna do my best to answer this in a way that it gets to the point, but also allows for some flexibility. We recognize that if you're with a company, you might want to be with your colleagues, right? You might want to go to the offices where your other teammates are going and meeting with their members of Congress. I think that's great. I think we can absolutely organize your schedule specifically. If you want to do that, let us know. We can organize your schedule in a way where you do a little bit of both. But what is most important is that you meet with your member of Congress where you live. And that's because that's the only office that you're technically going to be considered a constituent in. Now, if you're a business owner and you employ people in someone's district, that also makes you a constituent in a different way. It makes you a small business owner, a business owner. And there's ways to work that constituency angle as well. But so let's, I think we want to try to keep it as personalized as possible, your experience here. But it's really important that you meet with your member of Congress because you are their priority if you live in their district. I hope that's helpful. Again, we're not discouraging you going to other meetings with, with other folks from your company, just that it's really, really important that you meet with the member that's in the district that you live in. Other questions? That was a great one.
Not seeing any right now.
All right, well, thoughts or comments? I know I see some folks on here with a lot of experience at Policy Forum, so I'm not trying to put anybody on the spot, but any ideas or thoughts someone that has attended a Policy Forum would like to share? All right, I'm not seeing anything. Well, one thing I'm going to do really quickly here is I'm going to pop in the chat a link just in case there's someone on the call that doesn't know who their member of Congress is. There's a link for you to find out your district and look up your member of Congress. We'll be sharing again, as we said, we'll be sharing some additional resources on that landing page for the Policy Forum on our website, including our target list. So we're gonna make that public. I think it's important for people to know kind of how it works on the inside, the why, the why we're targeting certain members. But again, that is not to discourage folks that are going to be meeting with their members that aren't on that list. It's just a way for us to show how important it is that we get those people on board. They're kind of like the first line of defense, you know. We want to make sure we have them on our team. All right. Thank you all so much for joining us today for the webinar. Did I forget anything, Sam? You're usually good about making sure I didn't.
Well, I need to announce the Advocate of the Month, so I'd say that's pretty important. All right, so our Advocate of the Month is Nina Bondre. Congratulations. We really appreciate your work with Policy Forum in the past and your work with helping us doing some messaging for OTS devices. It's really good, it goes a long way in our efforts. So we really appreciate it, and we will be contacting you shortly for your prize. So thanks.
So I want to just give a second shout out to Nina on her work in the past, and why you know it's so important to highlight this kind of work. Many years ago, when she was early in her career as a clinician, we reached out to her and asked her to create a video explaining why some devices that are classified as off the shelf should never be provided to patients without clinical oversight. And her work on that, her help in preparing us for some hearings on Capitol Hill has actually helped us probably, if you think about, you know, what it really takes to move a piece of legislation, probably help us get where we are today with the members of Congress that are champions and that really understand the issue. And so to Nina, we are so grateful for the work you've done in the past, and we're so encouraged by how the little things that you can do, what might have been a heavy lift back then, has really helped us get where we are now. So thank you. All right, well, that's all I have today.
Yeah, same here. I think we have a question. Oh, it's from
Nina.
Nina says thanks. Well, of course.
All right. Well, thanks everyone. We will see you soon. We'll be back again before the Policy Forum. So if you've got additional questions about Policy Forum, reach out to us directly or join us for the next Advocacy in Action, and we'll chat some more. All right. Bye, everyone.
Thanks, y'all.